first technique we are gonna do in assessing the thoracic region is inspection. What you're gonna do is to look for any asymmetry in the posterior thorax of the patient. So, if you may, please. So look for symmetry. Look if the other side is lower than the other side. So that means there's a problem. Look for also for the posture of the patient. Patient with breathing problems tend to slouch, and look for symmetry. So my patient here has good posterior thorax. So she has good breathing patterns. So that's okay. So next is to inform the client of the findings. So ma'am, your posterior thorax is good. There is symmetry. The other one is good also. You have good breathing patterns and your posture is good. So next is to document the findings in your jot down notes. So the next technique we're going to do in assessing the thoracic region is for palpation. So I'm going to ask my patient first. Ma'am, is it okay if I touch you? Okay, so you're going to palpate starting from the apex of the lung, and you need to look for crepitus. It is a popping sound that might indicate air in the subcutaneous tissue which has escaped from the lung. Okay, good. So no crepitus. Next is for the assessing of tactile fremitus, which is the normal vibration sounds of the lung. If there is a strong vibration sound, it means that it's abnormal, and less vibration sounds is abnormal. So it should just be so-so. So what you're gonna do is to put the palm of your hand into the regions of the lungs. So if I may touch you, move again in a good position. Can you please say 99?
99.
Again.
99.
Again.
99.
Again.
99.
Good. Again.
99.
Again.
99.
Again.
99.
Okay, good. So my patient has good vibrations in her lungs. So that means it is tactile fremitus is good. So inform the patient of your findings. So ma'am, you have good, as I palpated into your thoracic region, you have good findings. You have no crepitus, and your tactile fremitus has good vibrations. Next is to document for the findings in your jot down notebook. So the next technique we are gonna perform is percussion. We are gonna percuss around the regions of the thoracic area and listen for resonant sounds. Then we are gonna do diaphragmatic excursion to measure the diaphragm or the movement of diaphragm. So first, may I touch you, ma'am? Can you please hold it carefully? So what we're gonna do is to listen for resonant sounds and percuss in a systematic way so that you can percuss all of the regions or the lobes of the lungs. Again, can you please hold your hair? So good. My patient or client has good resonant sounds in her thoracic region. Now we are gonna measure for the diaphragmatic excursion. So ask the patient first to exhale and hold. So inhale, ma'am. Exhale and hold. Okay, good. Now we are gonna mark. So now let the patient inhale and hold. So ma'am, inhale, hold. Okay, good. Exhale. Good. You're gonna mark that and measure for the diaphragmatic excursion. The normal findings of diaphragmatic excursion should be 3 to 5 centimeters. So my patient is in the normal range, which is 4 centimeters. So inform the client of your findings. Ma'am, your diaphragmatic excursion is within the normal range, which is 4 centimeters, and the normal range is 3 to 5. And I have heard resonant sounds in your lungs, which is also a good finding. Now, record your findings in your jot down notebook. So the next technique we are going to do in assessing the thorax or the thoracic region is auscultation. Now we are going to need our stethoscope and turn it into the diaphragm. Use the diaphragm area. What you're going to listen here is for clear breath sounds. If you're going to hear crackles, wheezing, it might mean that the patient in crackles might have fibrosis, and for the wheezing, the patient might have asthma. And watery or bubbly sounds might mean consolidation, meaning pleural effusion or pneumonia. So, ma'am, if I may, I'll still take you. So, you should press firmly to leave an imprint. Realistically, the patient should have taken off her shirt. So now I'm gonna start. If I may. Inhale, exhale, 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 inhale, exhale. Okay, good. So my patient has good breath sounds in all of the lobes of her lungs. So the next technique we are gonna do is called a bronchophony test, which should determine, or the patient should say 99, you should hear a muffled 99 sound. But if you hear a clear 99 sound, it might mean that the patient has consolidation, which means he or she has a fluid in her lungs, which could mean pneumonia or pleural effusion. So if you may say 99 whenever I auscultate you.
99, 99, 99,
99.
99, 99, 99, 99, 99, 99.
Okay, good. So my patient has muffled 99 sounds, so that would mean it is normal. The next technique we are going to do is the egophony test, which the patient should speak or say the letter E. So if the patient has good lungs, what you should hear should be a muffled sound, just like as the bronchophony test. But if you hear a clear A sound, that would mean consolidation or pleural effusion and pneumonia. So if you could say E, ma'am, whenever I auscultate. Please say E.
E. E. E. E. E. E. E. E. E.
Okay, so my patient has good or has negative egophony. So that means that my patient doesn't have consolidation, as per evidence also by the bronchophony test. Next is to inform the patient of your findings. So, ma'am, your lungs has good breath sounds. Bronchophony test is negative, meaning you have no pleural effusion, as so evidenced also by the egophony test. Next is to document your findings in your jot down notebook. So in summary, the thoracic region of my patient is good because it has symmetry and there is no asymmetry. Obviously, next is for the palpation, which my patient doesn't have any crepitus, and the tactile fremitus is good, which has good vibration sounds, as my patient said 99. Next is for the percussion, which the result is resonant sounds, good resonant sounds, and my patient also, or client, has a 4 centimeters diaphragmatic excursion, which is in the normal range of 3 to 5 centimeters. And lastly, in the auscultation, my patient has good breath sounds, and in the bronchophony sounds, which the result is negative, which means my patient has a muffled 99 sound when I auscultated, which means that my patient doesn't have any consolidation or pneumonia and pleural effusion, as per evidence also by the egophony test. So in my health teaching, you should always remember to eat healthy foods, avoid fat, greasy foods because it may cause acidosis, which would also affect your lungs. Next is the most important thing to take care of your lungs is to really avoid smoking. And please wear masks all the time, as we have evidence right now, we have COVID-19, please wear masks, preferably surgical masks or N95 masks to protect yourself from microorganisms and dusts. Also, avoid getting into fatigue because it might cause you asthma, and please avoid smoking. Thank you.